Hello friends, welcome to AI Medical School. In this video, we will talk about indirect-acting cholinergic drugs. I made this lecture with hard work, you can easily understand it. I try to use simple language for your understanding, so please watch the full video and give your remarks, and if you like it, support me in the form of a subscription and like the video. So let's start the lecture. Indirect-acting cholinergic drugs are those drugs that increase the cholinergic activity indirectly, such as by inhibiting the acetylcholinesterase. Indirect-acting cholinergic drugs are of two types. Number 1. Reversible inhibitors of acetylcholinesterase. Number 2. Irreversible inhibitors of acetylcholinesterase. Reversible inhibitors bind with acetylcholinesterase, and after sometimes it detaches from the enzyme. Irreversible inhibitor binds with acetylcholinesterase and doesn't detach from the enzyme until new enzymes are synthesized by the tissues. Agonists. Detail of reversible indirect-acting cholinergic drugs, acetylcholinesterases. It is an alkaloid derived from plants. Its structure is a tertiary amine. Tertiary amines are less polar, and quaternary amines are highly polar. It means tertiary amines are more lipid-soluble and quaternary amines are less lipid-soluble. So physostigmine is more lipid-soluble, so it will absorb from the gut electively, and it can cross the blood-brain barrier. Physostigmine will have more action on the ganglion because most of our ganglia are embedded in fats, and physostigmine are lipid-soluble. They can enter into fat and more have action on the ganglia. Physostigmine have a carbamate group. Physostigmine makes the labile covalent bond with acetylcholinesterase and inhibiting the acetylcholinesterase. Labile covalent bond means a bond that can eventually broken. So physostigmine binds with acetylcholinesterase strongly by labile covalent bond, but eventually, this bond breaks and drug goes away, and enzyme can then restart its function. Its duration of action is 30 minutes to 2 hours. There are other anticholinesterase drugs called neostigmine and pyridostigmine. Neostigmine and pyridostigmine are quaternary amines, and these drugs are synthetic. These drugs, like physostigmine, are also carbamates. And it makes the labile covalent bond with acetylcholinesterase and thus inhibiting the acetylcholinesterase. Its duration of action is the same as physostigmine. Then there is another anticholinesterase called edrophonium. Edrophonium is also tertiary amine, and it has an alcohol group and does not have carbamate group. Edrophonium binds loosely with acetylcholinesterase and inhibiting the acetylcholinesterase. But it is loosely bound with acetylcholinesterase, so due to this reason, its duration of action is 10 to 20 minutes. All of these drugs will be explained in detail later. Important points: irreversible anticholinesterase make the strong covalent bond with acetylcholinesterase. Initially, when they bind, they can be removed from the drug, but after few minutes they so strongly react with the enzyme that you cannot remove it. Irreversible anticholinesterase has a very special alkyl group. But once this alkyl group is detached after 30 minutes, it is impossible to remove the irreversible drug from the acetylcholinesterase. Irreversible anticholinesterase are drugs are isofluorophate, ecothiopate, malathion, parathion. All of these drugs have an alkyl group. This process of loss of alkyl group and then drug permanently inhibit the enzyme. This process is called aging. If someone wants to commit suicide by these irreversible anticholinesterase drugs and their drugs have gone into the body, then very rapidly you give pralidoxime as an antidote before the alkyl group is lost or before aging has occurred. You may save the patient. Such irreversible compounds are present in pesticides and insecticides, and if someone is exposed to these pesticides or insecticides or whatever such drugs take in high amount, then most of the acetylcholinesterase is inhibited permanently, and all the acetylcholine which are produced normally physiologically in our body will be accumulated dangerously in neuroeffector sites, and there will be massive cholinergic outflow. And that will produce signs and symptoms of toxicity by these irreversible drugs. There are your sites at which acetylcholine accumulate and produces complications. If some of these irreversible anticholinesterases cross the blood-brain barrier and goes to the CNS and enzymes are inhibited in the CNS, there will be a very strong toxic accumulation of acetylcholine in the CNS, And it may stimulate CNS so powerfully that the patient may develop convulsions and seizures. Acetylcholine may accumulate at sympathetic and parasympathetic ganglions, and there will be powerful pathological stimulation of ganglions. Acetylcholine may accumulate at the neuroeffector sites of parasympathetic nerve ending, and all over the body, there will be powerful muscarinic stimulation. There will be the accumulation of acetylcholine at the neuromuscular junction and nicotine receptors at the neuromuscular junction. When they are very strongly stimulated for a very long duration, then they produce nerve block and paralysis of the muscle. In such a situation we should give atropine. Advantage of atropine is that atropine will block the muscarinic receptors, so all those clinical problems are produced due to overstimulation of muscarinic receptors will be abolished. Tuned lie we should give an antidote. The classical example is pralidoxime. Thanks for watching. I hope you guys liked today's lecture, and I really appreciate your love and support. Keep support AI Medical School and share the knowledge with your friends.